So I'd like to present our second speaker, Mr. Brian Earp, who will be talking a bit more about the terminology of FGM and the ethics and law behind it as well. Mr. Brian Earp.
Okay, thank you. So can everybody see the presentation? Is it visible?
Yep, it's visible.
Okay, great. So I'm going to be talking about genital cutting practices and how we conceive of them. Why would we describe a practice as mutilation when others might see the very same act as an enhancement? And who gets to determine what a practice is called and what's ethically at stake in these labeling practices? That's going to be the focus of my talk today. So the typical starting point in these discussions is always the World Health Organization, which has sort of positioned itself as the authority on this topic. And so this is their definition, which I won't go over because it was mentioned in the last talk. But there are a number of problems with this definition, which are well known, and I'll only be able to cover some of them. One of them is that the definition defines mutilation in terms of the reasons for which the cutting is done, rather than, for example, the effects on the body or the perception or interpretation of the affected person. So I want to explain why that's important. Imagine that somebody is undergoing a genital surgery that on any view is for medical reasons. Let's say it's to remove a small amount of malignant tissue on the labia or something like that. But suppose it's a botched surgery. It goes very poorly. There's extensive scarring, there's disfigurement, there's functional difficulties. And suppose the person says, well, I feel mutilated by this botched surgery. Well, according to the WHO definition, because it was done for medical reasons, it shouldn't necessarily count as an instance of mutilation. So something seems a little bit off already. And perception here is important because the word mutilation, as was just alluded to in English, it denotes a negative or unwanted change to the body. So you can see that because when people volunteer for a surgery for what they take to be cosmetic reasons, we don't refer to those bodily changes as mutilations. So we don't say nose mutilation when somebody seeks out a rhinoplasty, for example. We don't say breast mutilation when somebody seeks out a breast augmentation. So clearly there's a value judgment involved in calling something a mutilation. And the question here is, well, whose values? Is it cultural insiders who maybe have a positive attitude toward a given practice? Is it cultural outsiders who may think of the very same practice as a human rights violation? Even within the culture, is it the majority who support the practice? Well, what about local dissenters, those whose voices are often excluded from these conversations, who may want to change the practice within their own community? Do their values get to determine which language we should use? Another problem with the definition is that it assumes there's only one legitimate reason for female genital cutting, regardless of consent. And consent will be important, I'll come back to it, but this is part of the sort of medical lens, which suggests that if something's done for medical reasons, then it's legitimate, whereas all other reasons are illegitimate. Social reasons are illegitimate, aesthetic reasons are illegitimate, religious reasons are illegitimate. Well, who decides what's a legitimate reason? And how should these reasons weigh against each other? Even if we agree that it should be done for medical reasons, what counts as a medical reason? Who decides? Is it the World Health Organization that gets to decide for everyone? What about local practitioners and indigenous medicine? There's different concepts of medicine in different places. So which concept should trump? If the cutting is done by a health professional, as it's often done in Malaysia, does that make it a medical procedure because it's been medicalized? Are we only thinking of, stereotypical Western medicine as something that determines whether it counts as a medical reason? What if it's done for mental health? In many cultures that practice male or female genital cutting, the idea is that it's meant to improve the body. The thought is it makes the body more acceptable to sexual partners, for example, or it's thought that it will help the individual integrate with their community or feel identified with their ancestry. And the thought then is that that might improve their mental health. Well, mental health is a part of medicine. So can you cite some of these benefits as a reason for why it's done for medical reasons? Well, suppose active genital cutting is done for clearly cultural or religious reasons, but the family or the provider knows that those folks over the WHO seem to be impressed by medical reasons. Well, what if they add some medical reasons to the mix and say, oh, well, it's mostly for cultural reasons, but also, there's some health and hygiene reasons for why we're doing it as well. Is now it's no longer mutilation because you added some medical reasons? What if you can find some legitimate health benefits? What if female circumcision lowers the risk of infection in the excised tissue? Well, is it not a mutilation anymore because you found some health benefits according to this particular view? I think the upshot here is that you can't get inside people's heads and determine what the reason is for genital cutting. As the professor just described, there's historical reasons that change over time. There's conscious and unconscious reasons. There's reasons that you give when you're telling other people why you do it publicly. There's reasons you may give to your family. You shouldn't define if something's a mutilation based on boiling it down to what you take to be the reason for doing it. I think the relevant ethical concept is the practice medically necessary? And so I'll just give you a definition that comes from a recent paper by myself and colleagues where we say an intervention to alter a bodily state is medically necessary when the bodily state poses a serious time-sensitive threat to the person's well-being due to a functional impairment in an associated somatic process, and the intervention, as performed immediately, is the least harmful feasible means of changing the bodily state to one that alleviates the threat. So this is the concept that matters here that we should be thinking about, but for some reason, medical reasons is the term that's been adopted by the World Health Organization. Now, another absence from the definition is any mention of consent. And this has some very strange implications. So let me spell out those implications. One is that it implies that adult, consensual, Western-style elective or so-called cosmetic genital surgery, for example, labiaplasty, which is increasingly performed on teenage girls in the United Kingdom and the United States, that should count as mutilation on this view, which the World Health Organization doesn't seem to think because it hasn't expressed any interest in eliminating this Western practice, which is done for non-medical reasons. In fact, the World Health Organization exclusively focuses on what could be called non-Western female forms of genital cutting, which should already raise some red flags. So what's obvious is that the mere cutting or removal of healthy genital tissue, which describes labiaplasty, for non-medical reasons, which describes it when it's done for cosmetic reasons, is clearly not sufficient to ground the WHO's claim that non-Western forms of FGC are morally wrong, human rights violations, torture, and so forth. So here's one way you might adapt the definition. I think this is more promising. What if you say it's the non-consensual cutting or removal of healthy genital tissue for non-medical reasons? If you don't know that the person wants this to happen to their body, if you don't know what their perspective is on it, maybe it's the coercive nature of it that should allow us to call it an act of mutilation. Well, I think that's promising, but then that would mean that non-consensual ritual male circumcision would be a human rights violation because it's the non-consensual cutting or removal of healthy genital tissue for non-medical reasons. But the World Health Organization isn't interested in eliminating this practice, which is also familiar to Western culture and happens to be a predominant birth custom in the United States, which has an outsized influence on the World Health Organization. Now, the World Health Organization tries to justify this seeming double standard by citing health benefits for male circumcision, which it derives from studies of adult, voluntary, medicalized circumcision, and then sort of just assumes that that also applies to non-consensual childhood ritual male circumcision, and there's no evidence of that. But let's go ahead and take the premise. Let's suppose that what they really mean by mutilation is the non-consensual cutting or removal of healthy genital tissue that has not been statistically associated with potential health benefits in adults. Maybe that's what they mean. Okay, well, I've just done a paper on this, which you can look into if you want to see the arguments here in more detail. But let's go ahead and consider the health benefits argument. I'll tell you a story. In 2019, I was at an international experts meeting on FGMC, and one of the other presenters asked a question of the World Health Organization representative who happened to be there. And my colleague said, given that virtually every society that practices ritual female genital cutting also practices ritual male genital cutting, typically in a parallel rite of passage that serves analogous social functions, isn't the World Health Organization sending mixed messages about human rights to practicing communities? For example, they seem to be saying both of the following. All ritual forms of female genital cutting, no matter how minor and irrespective of consent, are unambiguous human rights violations that must be eliminated from society and must under no circumstances be medicalized, even as a harm reduction measure. Well, at the same time, ritual male genital cutting of non-consenting minors within the very same communities is not a human rights violation, no matter how severely it's done and no matter how unhygienic, and it should not only be medicalized, but in fact expanded to groups that don't currently practice it. Well, the WHO official replied, male genital cutting has health benefits, FGM has none. So that was supposed to be the knockdown argument. Well, The following thought occurred to me. I didn't have a chance to ask it of the official, but I said, okay, so if medically unnecessary female genital cutting did have some health benefits, are you saying that the WHO would suddenly change its mind and concede that it's now okay to cut and remove healthy genital tissue from non-consenting girls? I imagine the answer would be no, which means that this justification is illegitimate. Now, let's go ahead and look at it anyway. The World Health Organization primarily refers to studies concerning a reduced risk in the transmission of HIV in areas with low rates of male circumcision and an epidemic of heterosexually transmitted HIV, which doesn't apply to the United States, the United Kingdom, or where have you. These HIV data come from studies of adult voluntary circumcision, not the non-voluntary circumcision of minors, so an extrapolation is being made that hasn't been scientifically validated. The reported protection is only for men from the female to male condition under ideal clinical settings. The real world data are conflicting because there's behavior change issues that you can't account for when you do this in the real world. And the one trial that looked at male to female transmission showed an increased risk to women for HIV if their male partners were circumcised at about the same rate, 60% relative risk increase. And so they had to stop the trial early for futility, and then they just don't cite this trial anymore. And the idea is that maybe women will be indirectly protected if it works for men. The problem here is that if you tell men that they have some sort of protection from having a surgery, then they think to themselves, well, I don't have to wear condoms anymore. Otherwise, why would I get a surgery? Well, that obviously increases your risk of transmitting HIV to your vulnerable female partners or male partners, as the case may be. Obviously, if you wear condoms consistently or you're faithful to an HIV negative partner, there's no benefit of circumcision in addition to the benefit that's gained from condoms and being faithful. Nevertheless, you might say on ethical grounds, if an adult wants to use genital surgery for prophylaxis while still having to maintain all the other safe sex practices to avoid increasing risk, in addition to which there's no remaining benefit of the surgery, that might be their choice if you assume that there's no coercion. Unfortunately, the way that this program is rolling out in Africa is highly coercive. And because men aren't volunteering at the level that is required by the WHO quotas, they're now targeting younger and younger boys who are 15, 14, 13, 12, 11, some of them being rounded up from school and circumcised without even parental awareness, the local officials trying to meet their quotas. So there's a real big concern about this. But anyway, children are not at risk of STIs unless they're molested. So you might think you should wait until they decide whether this is something they want to undertake when they're able to consent. Okay, against that view, maybe there are some health benefits in childhood that we should think about, and that would justify the distinction between male and female genital cutting. So let's look at that argument. The main potentially meaningful health benefit that's been cited for non-consensual male circumcision is a potential reduction in the risk of a urinary tract infection. According to the American Academy of Pediatrics, it would take about 100 male circumcisions to prevent one likely treatable urinary tract infection. Now, girls are about 4 to 8 times more likely than boys to get a UTI before the age of 5, but of course, surgery isn't recommended as a way to try to prevent these infections. Rather, they're treated. But let's just imagine that you could do this. Suppose that removing healthy tissue from an infant's vulva, so maybe trimming the labia to avoid cutting the clitoris, let's imagine that that similarly reduced the risk of a urinary tract infection. So 100 infant labiaplasties are needed to prevent one likely treatable urinary tract infection. Would the WHO say that girls do not have a right to bodily integrity, according to which such cutting would morally wrong them? I think the answer is no. They would say healthy, nerve-laden genital tissue is valuable in its own right, and so removing it or risking damage to it without urgent medical need is itself a harm. They would insist that all more conservative means of addressing potential infection should be exhausted before surgery is employed, because surgery always carries risk, even if you don't intend to remove tissue in the case of pricking. Girls have an inviolable moral right, they would say, against any medically unnecessary interference with their private sexual anatomy to which they themselves do not consent when they're sufficiently mature. So the implication of all this is that the health benefits argument is a red herring, and it's not clear whether it's really sincere because it falls apart as soon as you look at it. Again, all you have to ask is, if FGM did have health benefits that are comparable to those that have been attributed to male circumcision, would it suddenly become permissible if it's done to a non-consenting girl? Well, unless the health benefits were central to her well-being and could not be achieved in any less harmful way or by waiting for her consent, the answer is obviously no. In fact, the WHO opposes medicalization of female genital cutting, even as a harm reduction measure. Even a ritual nick performed by a trained physician with a sterile instrument and pain control is considered a rights violation by the WHO. So it seems that the WHO believes that girls have a human right to bodily integrity that's violated by all medically unnecessary genital cutting, no matter how superficial, whether or not evidence of health benefits could be found. But if this is a human right, then it must apply to all humans, including males and children with intersex traits or differences of sex development. But the WHO has no interest in protecting these children from genital cutting. Well, that's a very interesting question, why? And a colleague, Charlie Carpenter, has done some sociological work of the human rights gatekeepers who work at the World Health Organization and the UN and so forth. And what she's found is that non-consensual male genital cutting for cultural or religious reasons is prevalent within the families and the communities of the Western human rights gatekeepers who decide what counts as a violation. She writes, unlike many other practices human rights professionals condemn but do not participate in, the practice of male circumcision is widespread in their own personal social networks. Confronting this fact evoked defensiveness from those who had circumcised their own sons for non-medical reasons and were loath to think of themselves as human rights abusers. So it seems that Africans and Middle Easterners and Southeast Asians who circumcise both their sons and their daughters, and often they circumcise their daughters less invasively than they circumcise their sons, well, it's easier to imagine them as human rights abusers because they are the proverbial other to Western policymakers. Now, with regarding the comparison about the invasiveness of the surgery, a forthcoming paper by Richard Schwader makes the following claim. Among some Muslim groups, and as I understand this is true in Malaysia, there's a gender-inclusive version of the Jewish Abrahamic covenant. Not only the boys, but also the girls are circumcised. In the Jewish custom, girls are excluded from what's considered the main rite of the religion. So on some view, by having both boys and girls circumcised, there's a form of equality. The procedure for girls amounts to a nick, abrasion, piercing, or small cut restricted to the female foreskin or prepuce. The custom is less invasive than a typical male circumcision, as routinely and legally performed by Jews and Muslims within the very same families. And Rick Schwader asks, if the practice is legal for the gander, why should it be banned for the goose? So this is an increasing move that's happening now among defenders of ritual male circumcision. They're arguing that since Western law and policy tolerates our cultural practice for the sake of equity, so too should we tolerate female circumcision as long as it's less invasive than ritual male circumcision. My colleagues and I have argued against this view. We tend to argue that there should be a concern for the child to be able to make their own decision. But anyway, this is an argument that's gaining traction. So this sort of situation was recently tested in the United States concerning this woman, Jumana Nagarwala, who's a member of the Daiwoodi Borah. The Daiwoodi Borah are primarily based in India and Pakistan, and according to the trade routes that were shown earlier, they practice a version of type 1, so there may be some partial cutting or removal of the clitoral hood. In some accounts, they practice a pricking like what's done in Malaysia. There's an immigrant community in Detroit, Michigan. The alleged cutting was done by a doctor in a clinical setting. The Borah practice khatna, an Arabic word for circumcision that's a gender-neutral term, so they circumcise both boys and girls for religious reasons. And the typical male operation in this group is more invasive than the typical female operation, but only the female operation was regarded as criminal. So what happened? In 2018, this judge, a federal judge, Bernard Friedman, ruled that the US anti-FGM law was unconstitutional and it was struck down. Now, a replacement law has just been passed and we can talk about that. But the argument he made was very interesting. Why is the anti-FGM law unconstitutional according to this judge? Well, he said, we have a federalist organization in the United States where the National Congress is not allowed to pass laws that apply to all 50 states unless it meets certain specific requirements, like the practice affects interstate commerce or something like that. And so he said, actually, the pricking that's done by the Daiwoodi Borah constitutes local criminal activity, which means the states have to be able to legislate it, not the national government. So that's why the law was struck down. But what's the local criminal activity he had in mind? He said this pricking, if it's medically unnecessary and non-consensual, just is a physical assault, and a physical assault is already illegal in all 50 states. So this creates an interesting situation. He's avoided confronting the issue of sex or gender at the federal level, but he's passed it down to the states, because if ritual nicking that's medically unnecessary is a physical assault, then doing a more invasive procedure to boys that's medically unnecessary is presumably also physical assault. Nevertheless, he's aware of the equal protection problem. He said, as laudable as the prohibition of a particular type of abuse of girls may be, it does not logically further the goal of protecting children on a non-discriminatory basis. So let me just sort of review what I've been talking about, and then I'll move to the final slides here. The first thing is that the WHO definition of FGM is scientifically meaningless, it's conceptually inadequate, and it's incoherent. There's no view on which this is a sensible definition of the word mutilation. Western law and policy on FGM is culturally biased and hypocritical. It selectively targets only non-Western associated forms of female-only genital cutting, regardless of the actual level of harm or the capacity of the person to consent. And it fails to condemn objectively comparable procedures that are more familiar to Western culture, like ritual male circumcision or cosmetic labiaplasty, as it might be performed on increasingly young girls, as I said earlier. So scholars who work on in this area use the term genital cutting now for females, males, and children with intersex traits who may be male or female or identify as intersex. The idea here is that culturally relative or biased value judgments shouldn't be baked into the very meaning of supposedly scientific terms. Rick Schwader, who I mentioned earlier, has said, imagine you're having a debate about the moral permissibility of abortion, and you ask somebody, what's your position on baby murder? Well, like it was just said, obviously that would be offensive to the view of the other person who doesn't view it as baby murder. In other words, you're defining out of existence the very point of contention. And so this leaves no room to have an honest conversation about the different attributes of different forms of genital cutting. It leaves no room to have an honest conversation about what is morally at stake in these different forms of cutting and why they're valuable to certain cultures and why they're seen as foreign to other cultures. So you can't just define practices in an offensive way and expect to have an adult conversation with your interlocutor. So what's a more ethically coherent position than the one that has been jerry-rigged by the World Health Organization? Well, I think to start to have this conversation in an honest way, you have to begin by acknowledging that cultural or religious body modifications of children are virtually always undertaken with the belief that they enhance the child's body, not that they cause net harm to the child, in line with locally prevailing social, aesthetic, medical, spiritual, symbolic, or other norms. So no loving parent is trying to mutilate their child, and to go into a conversation accusing somebody else of essentially being a barbarian is not a respectful way to start. I want to say something about this. I mentioned this at the World Health Organization meeting a couple of years ago, and the World Health Organization official said, well, when we're talking to the communities, obviously we use whatever language they're comfortable with, but we know that it should be called mutilation. And I just thought that was incredibly condescending and even more offensive. Decide what the term should be used and use it with everybody equally, and don't build your value judgments into the term. Okay, now here's the problem. If the parents or community believes that they are enhancing the child's body by altering it or exposing it to a certain kind of a risk to draw a drop of blood, their view that it's an enhancement isn't something that's necessarily universally shared, and it's the sort of thing that somebody could draw a different conclusion about if they have a different set of beliefs or values. So the very status of these culturally motivated genital modifications as enhancements versus diminishments or even mutilations is unstable and context dependent. Beliefs and values can change with new information or a new context or a new perspective. So I'll just give an example. A friend of mine was raised in a very conservative religious community and was circumcised for religious reasons, but he grew up to become a secular person, and he doesn't believe in God, and he doesn't adopt these particular views. And he says that every time he uses the toilet or takes a shower or has a sexual experience, he sees a scar on his genitals, which makes him feel that he's been marked with a sign of his parents' religious beliefs that he doesn't share. So obviously, if you share your parents' religious beliefs, you might think of this very same bodily state as being a sign of something very important, a covenant with God. But if you don't believe in God, then you just have a scar on your penis. So the idea is that this act, when you do it to a child, you don't know how they're going to evaluate it later in life. You don't even know if they're going to think it was reasonable for you to take a prick to their genitals to draw a drop of blood. This seems like a sensitive part of the body where you might rationally think that no sharp object should be taken anywhere that's part of your body. Here's some further examples. This is from the Daiwoodi Borah community that I mentioned earlier. As the years rolled by, I attained puberty, and after experiencing my first menstruation, I became aware of my sexuality. At this point of time, my second eldest sister gave me a book to read on sexuality. The full impact and realization then of that awful, painful, and life-changing procedure which I was made to undergo at the innocent age of 7 years dawned on me. I was privately distraught and enraged to learn that I had been robbed of my full feminine rights to sensuality and sexuality. This feeling disturbs and traumatizes me, and feelings of inadequacy and incompleteness remain with me till today, even at the age of 61. After making a private self-examination, I found that the prepuce or foreskin of my clitoris had been cut off. Here's an example told to Ron Goldman. The shock and surprise of my life came when I was in junior high school. I was in the showers after the gym. I wondered what was wrong with those penises that looked different from mine. I soon realized that I had a part of me removed. I felt incomplete and very frustrated when I realized that I could never be like I was when I was born, intact. That frustration is with me to this day. Throughout my life, I have regretted my circumcision. Daily, I wish I were whole. Now, I've read in some depth the testimonial literature for females who've come to feel resentful about their early genital cutting experiences, males who come to resent their genital cutting experiences, and also those with ambiguous genitalia or intersex traits. And often you don't see that there's any mention of complications. The person doesn't say, well, the surgery was botched. Rather, it's that they have a change of mind or perspective when they come into an awareness as an adult about what happened to them when they were a child. And a common theme, regardless of the sex or the gender of the person, is that it's the sheer involuntary loss of healthy sexual tissue, or the loss of genital intactness, or the loss of choice about something that might be seen as a very personal decision. That's what's often felt as a harm or as a form of disrespect. So what should we think about these cases? My colleagues and I have proposed the following ethical argument. While adults are in a position to decide whether effect or risk X is valuable enough to justify incurring loss Y, so if they think that the enhancement or the social benefits or the religious significance is valuable enough to justify the risk that something might go wrong with a slip of the needle, children don't have the capacity or the life experience to make those kinds of trade-off decisions. They don't know what they will value when they grow up, and nor do their parents, especially in a global multicultural world where people move to different parts of the world or interact with people with different points of view. So while an intervention that improves X may count as an enhancement for the individual who doesn't care much about Y, another person valuing Y over X will view the very same outcome as an impairment. In these kinds of cases, that is, cases in which the very status of an intervention being an overall enhancement versus impairment is controversial, the weight of considerations should shift toward delaying the intervention until the person who will be affected by it or have to live with the consequences is able to decide for themselves. Now, again, I think medical necessity is an exception here, and I want to explain why. Almost everybody puts a very high value on not dying prematurely or on preserving core bodily functions, alleviating relatively direct threats to their well-being that are recognized as such robustly across culture, time, and circumstance. Imagine that you're considering whether to do an open heart surgery on a non-autonomous person, maybe somebody who's passed out on their way to the hospital or a very young child, so you can't get their consent. Well, you wouldn't hesitate to perform the surgery, even though it's radically invasive, exposes the child to a lot of risk, and involves opening up their chest cavity, because you're very very justified in thinking that they would consent if they were autonomous. And moreover, you can think that regardless of their cultural background or beliefs, and despite any potential changes in perspective. You may not be able to have 100% confidence, but you can have about as much confidence as you could ask for, that this is something the person would consent to, regardless of the religious beliefs they eventually come to hold, regardless of the metaphysical views they might adopt. You have to compare this to the local epistemologies that justify culturally motivated genital cutting, where that you don't have the same guarantee. These are metaphysical beliefs that are not universally shared, that you might abandon when you grow up. They might be based in contingent or unstable aesthetic norms that apply to one cultural group but not to another. And so people can travel to a different country with different practices, or read a critical article about the practice that was done to them when they were a child on the internet. They might leave their community that they were raised in, and then they can have a change of mind, and they can come to see that what happened to them was something they prefer didn't happen to them. So I think in the future of law and policy, there's going to be a shift away from the x-axis here, which is determining whether a child has stereotypically masculinized or feminized genitalia or something in between as the basis upon which you should decide whether they're protected from genital cutting, to the y-axis, which is a question of how much autonomy does the person have? Is the person able to decide that having a sharp object taken to this sensitive part of their body is a risk that they're willing to tolerate because they themselves value the trade-off in the full light of their adult thinking? So these same colleagues I mentioned before, there are representatives from pretty much every continent and across many disciplines. We recently argued that cutting any person's genitals without their own informed consent should be seen as a violation of their right to bodily integrity. And so we argue that it's morally impermissible to cut a person's genitals unless they're non-autonomous, so they can't consent, and the cutting is medically necessary. Now, there are a lot of open questions here, even if you find that argument persuasive. There was the question of how would you change WHO policy to remove the existing cultural and moral double standards? Should we be thinking about legal changes being applied here, or is it just a matter of consciousness raising and advocacy and education? Many other open questions, but because I've gone on for half an hour, I'll go ahead and end there. And thank you for your attention.